Hair loss is a disease that develops when the body's immune system attacks hair follicles. Hair loss is also called alopecia areata, which is an autoimmune disorder that causes your hair to come out. The amount of hair loss is different in everyone. Some people lose it only in a few spots, others lose a lot. There are different types of this condition. Alopecia areata is most common in its main form, but there are other, more rare types. The first one is involutional alopecia, is a natural condition in which the hair gradually thins with age. More hair follicles go into the resting phase, and the remaining hairs become shorter and fewer in number. The second is androgenic alopecia, is a genetic condition that can affect both men and women. Men with this condition, called male pattern baldness, can begin suffering hair loss as early as their teens or early 20s. It's signed by a receding hairline and gradual disappearance of hair from the crown and frontal scalp. Women with this condition, called female pattern baldness, women experience a general thinning over the entire scalp, with the most extensive hair loss at the crown. Telogen effluvium is temporary hair thinning over the scalp that occurs because of changes in the growth cycle of hair. A large number of hairs enter the resting phase at the same time, causing hair shedding and subsequent thinning. Scarring alopecias result in permanent loss of hair. Inflammatory skin conditions such as some forms of lupus and lichen planus often result in scars that destroy the ability of the hair to regenerate.
Ironically, hair loss can cause psychological disorders and affect a person's sense of self and identity. How, if you got hair loss? Well, of course it can leave your self-image fractured. In 2004, Hachu lists the patient perceived of hair loss, and the result were they got shame, anger, embarrassment, humiliation, disgrace, hate, disgust, fright, depressed, worrying, frustration, uncomfortable, dissatisfaction with body image, feeling of being older, sense of inadequacy, loss of self-confidence, unhappy about appearance, reduced worth, reduced social acceptance, feeling of helplessness, social stress, powerlessness, and so on. In medical terms, hair loss can cause antisocial personality disorder, post-traumatic stress disorder, generalized anxiety disorder, major depression, adjustment disorders, obsessive-compulsive disorder, panic disorder, and social phobia. Sometimes, it can even lead to suicidal intent.
Nowadays, long-term side effects following COVID-19 infection have caused many devastating symptoms, from loss of taste and smell to brain fog and fatigue. Hair loss has also been reported as a common symptom. This side effect could be one of the most alarming. The questions are, is hair loss really a symptom of COVID-19? And what should you do to solve it?
While we know there is a link between COVID-19 and autoimmune conditions, the research on COVID-19 and autoimmunity continues to develop. Sometimes, patchy hair loss can be due to an autoimmune condition or alopecia areata. Many people notice hair loss in the months after recovering from a COVID-19 infection. We now know that more than 20% of people hospitalized with COVID-19 lose hair in the 3 to 6 months after discharge. Other studies that include people with milder symptoms suggest that hair loss after COVID-19 may actually be much more common. There are many reasons why you may lose your hair, and stress is a common cause. The clinical term for hair loss that's related to stress is telogen effluvium. It usually happens about 3 months after a stressful event, and it can commonly last for up to 6 months. Telogen effluvium often happens after other stressful life events such as having a baby or a major surgery. Cases of telogen effluvium have grown a lot since the beginning of the COVID-19 pandemic. They are up over 400%. While we don't fully understand why this is the case, it is thought to be related to the stress of having COVID-19. There's no evidence yet that the COVID-19 virus directly causes this hair loss.
Can you regrow your hair after experiencing telogen effluvium?
Simple answer is yes, hair will regrow after experiencing telogen effluvium. It usually takes 3 to 6 months to see hair regrow.
How can you prevent stress-related hair loss?
If you have a stressful event, such as a COVID-19 infection, there may be some steps you can take to prevent hair loss. This includes having good nutrition, managing stress, and taking care of your hair. Find ways to manage stress. Stress can cause many physical and emotional symptoms, and it can be challenging to learn to manage stress. There may be some steps you can take to help reduce your stress levels. For example, exercise, practice mindfulness, have healthy relationships, focus on good nutrition. Hair needs good nutrition to grow and be healthy, especially protein and key vitamins and minerals such as iron, vitamin D, vitamin C, zinc, folic acid, and vitamin B12.
Well, The bottom line of this video is that months after recovering from COVID-19, many find that they start to lose hair. This condition, called telogen effluvium, is thought to be caused by the stress of having COVID-19. There may be some steps you can take to help protect your hair. The good news is that hair will regrow after telogen effluvium, but it may take some time and patience.